Refractive errors. Introduction. Refractive errors are common vision disorders that occur due to the inability of the eye to properly focus light on the retina, leading to blurred vision. These errors are among the leading causes of visual impairment worldwide and can significantly affect daily activities if left untreated. The primary types of refractive errors include myopia, nearsightedness, hyperopia, farsightedness, astigmatism, and presbyopia. Early detection and management are crucial in preventing complications such as vision loss, eye strain, and headaches. Definitions. According to the World Health Organization, WHO, refractive error is a condition in which the optical system of the eye fails to bring parallel rays of light to focus on the retina, resulting in blurred vision. The American Optometric Association defines refractive error as a vision condition that results from the shape of the eye preventing light from focusing directly on the retina, which can be corrected using prescription glasses, contact lenses, or refractive surgery. Risk factors. Several risk factors contribute to the development of refractive errors, including genetic predisposition. A family history of myopia, hyperopia, or astigmatism increases the likelihood of developing these conditions. Prolonged screen time and near work, excessive use of digital devices and prolonged reading without breaks can lead to digital eye strain and myopia progression. Lack of exposure to natural light. Studies suggest that reduced outdoor activity and inadequate sunlight exposure can contribute to the onset of refractive errors, especially in children. Aging. As people age, the elasticity of the eye lens decreases, leading to presbyopia. Systemic diseases such as diabetes. Uncontrolled diabetes can lead to fluctuations in vision due to changes in the shape of the lens. Poor dietary habits. Deficiency of essential vitamins and minerals required for eye health can contribute to vision problems. Environmental factors. Poor lighting conditions, excessive UV exposure, and pollution can affect visual health. Etiology. Refractive errors occur due to structural abnormalities in the eye, including myopia, nearsightedness. The eyeball is elongated, or the cornea has excessive curvature, causing light to focus in front of the retina instead of directly on it. This results in difficulty seeing distant objects clearly. Hyperopia, farsightedness. The eyeball is too short, or the cornea has insufficient curvature, making it difficult to focus on close objects as light focuses behind the retina. Astigmatism, irregular curvature of the cornea or lens leads to distorted or blurred vision at all distances. Presbyopia, a natural aging process where the eye's lens loses flexibility, making it difficult to focus on close objects. Pathophysiology. Light enters the eye through the cornea. In myopia, the eyeball is elongated, causing light to focus in front of the retina. In hyperopia, the eyeball is shortened, causing light to focus behind the retina. In astigmatism, irregular corneal curvature causes multiple focal points. In presbyopia, the lens loses elasticity, reducing its ability to focus on near objects. Clinical manifestations. Symptoms of refractive errors vary depending on the type and severity of the condition. Common clinical manifestations include blurred vision, difficulty in seeing objects clearly, either near or far. Eye strain and headaches, due to continuous effort to focus. Squinting to see clearly, helps improve focus temporarily. Difficulty reading or seeing distant objects, a common symptom of myopia and presbyopia. Frequent changes in eyeglass prescription, indicating a progression of the refractive error. Double vision, diplopia in cases of severe astigmatism. Diagnostic tests. History taking. Chief complaints, blurred vision, eye strain. Past medical history, diabetes, eye surgeries. Family history, refractive errors, glaucoma. Medications, steroids, antihistamines. Physical examination. Visual acuity test. Refraction test. Slit lamp examination. Blood tests. Not typically required for refractive errors. Diagnostic tests. Visual acuity test, Snellen chart determines clarity of vision. Refraction test, assesses the exact prescription for corrective lenses. Retinoscopy, measures how light reflects from the retina. Automated refraction, uses computerized technology to determine refractive errors. Keratometry, measures the curvature of the cornea. Corneal topography, creates a detailed map of the corneal surface. Medical management. Prescription eyeglasses, most common and effective method for correcting refractive errors. Contact lenses, provide a wider field of vision but require proper hygiene to prevent infections. Pharmacological treatment, atropine eye drops can slow myopia progression in children. Lifestyle modifications, reducing screen time, taking breaks while reading, and performing eye exercises. Surgical management. These procedures aim to reshape the cornea or replace the lens to correct the eye's focusing ability. Below is a detailed explanation of the surgical options, their components, indications, techniques, and postoperative care. A laser-assisted surgeries. LASIK, laser-assisted in situ keratomylesis. LASIK is the most commonly performed refractive surgery. It involves creating a thin corneal flap, reshaping the underlying corneal tissue with an excimer laser, and repositioning the flap. PRK, photorefractive keratectomy. PRK is similar to LASIK but does not involve creating a corneal flap. Instead, the outer corneal epithelium is removed, and the underlying stroma is reshaped with an excimer laser. LASIK, laser-assisted subepithelial keratectomy. A hybrid of LASIK and PRK. LASIK involves preserving the epithelial layer as a flap, which is replaced after laser ablation. SMILE, small incision lenticule extraction. A minimally invasive procedure that uses a femtosecond laser to create a lenticule within the cornea, which is then removed through a small incision. B. Lens-based surgeries. Refractive lens exchange, RLE. RLE involves replacing the eye's natural lens with an artificial intraocular lens, IOL, to correct refractive errors. Phakic intraocular lenses, PIOLs. PIOLs are implanted in front of the natural lens to correct refractive errors without removing the natural lens. C. Corneal inlays. Small devices implanted in the cornea to improve near vision, primarily for presbyopia. Dietary management. A balanced diet rich in essential nutrients can support eye health. Vitamin A, found in carrots, spinach, and sweet potatoes. Omega-3 fatty acids, found in fish and flax seeds, reduce dry eye symptoms. Lutein and zeaxanthin, present in leafy greens and eggs, support macular health. Zinc and vitamin C, found in nuts and citrus fruits, reduce oxidative stress. Nursing management. Preoperative nursing diagnoses and interventions. Anxiety related to surgery. Provide detailed information about the procedure. Offer emotional support. Teach relaxation techniques. Risk for infection. Educate on proper hand hygiene. Administer prophylactic antibiotics as ordered. Deficient knowledge about the procedure. Explain the surgical process. Provide written materials. Disturbed visual perception. Ensure proper lighting. Assist with preoperative visual assessments. Risk for injury. Ensure a safe environment. Assist with mobility as needed. Postoperative nursing diagnoses and interventions. Acute pain related to corneal abrasion. Administer prescribed analgesics. Apply cold compresses. Risk for infection. Monitor for signs of infection. Administer antibiotic eye drops. Impaired visual perception. Assess visual acuity. Provide protective eyewear. Anxiety related to recovery. Reassure the patient. Provide follow-up instructions. Risk for dry eye syndrome. Administer lubricating eye drops. Educate on avoiding dry environments. Complications. Chronic headaches and eye strain. Increased risk of eye infections, due to contact lenses. Retinal detachment, in severe myopia. Blindness, if untreated in severe cases. Prevention. Regular eye check UPS. Reducing excessive screen time. Following a balanced diet rich in eye-friendly nutrients. Using proper lighting while reading or working on screens.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.